For those of you that just joined us, thank you. If you would feel more comfortable turning off your camera and changing your name for this, because this is a sensitive topic, please feel free to do so. Ms. Latoya Ray would like to have more of a dialogue with this presentation. So please feel free to do whatever is more comfortable for you. Ready, Latoya, go ahead.
Good morning, everybody. Like she said, my name is Latoya. This will be more of like a sensitive topic and a dialogue. You know, I work with adults mainly, 18 and up, all the way. I think we have someone now who's in his mid 70s in the program now, who again works in our program outpatient for our PHP program, which is for mental health, who they come in who are functioning but don't really need the level of care for a true inpatient, but they're struggling. And then the second program we have is the Iop program, which looks at people who are struggling with substance abuse. One of the things that I want to be very clear about, and the reason why I chose this title, is because I believe that mental illness is something that impacts many, many people. And it's something that, as we learn more about, we can work as a community to overcome. And it is a big passion for me. So I do believe we have two moderators, Miss Mary and Miss Adele. So if you have questions, just let us know and we will go from there, okay? So when we think about illnesses, in the medical field, they use the ICD-10, which is what basically tells us what an illness is, how we bill for it, how we code it, what symptoms we're looking for, and all that other stuff. There are more than 14,000 illnesses that we have. And I like to start by saying, when we think about the fact that there are more than 14,000 illnesses, nobody likes to be told that they have something going on with their body. Nobody likes to be told that there is something wrong, quote unquote. There's something happening with them. And, you know, it can be something as minor as you having low iron, but you still have to adjust your diet. You still have to adjust what's going on with you. To something as significant as you having cancer, but it still means that there's something going on with your body. Does that make sense? And so when you get a diagnosis and the doctor tells you, hey, here's what's going on, there are many different things that can happen in that moment. Sometimes you can feel a sense of anger. You can feel a sense of betrayal of your body. Because a lot of times people are eating right, they're working out, they're doing everything that they're supposed to be doing, and yet something happens in their body. One thing that people don't often talk about that they feel is a sense of relief. Because sometimes when you find out, I've been really tired, I've been experiencing these dizzy spells, what is going on? And at least now you have a name with it. So being able to figure out what of these 1,400 things is going on gives you a sense of relief. Sometimes when we talk about illnesses, the doctor gives us these names and we're like, what is that? I have no idea what that is. You know, the same thing happens with when we're looking at mental health as well. So when we talk about that, does anybody have a guess as to how many there are for mental illness? How many diagnoses there are for mental illness? I can't see everybody, so I don't know if somebody's raising their hand or anything, so I can't see that on my screen. Does anybody have a guess? You can just shout it out.
You can feel free to unmute yourself or use the chat. I am monitoring the chat.
Don't be shy, guys. No wrong answer, just a guess. Someone said 52 million.
I was gonna say
I only
like
got
6,000.
14,000.
Yeah, I was gonna say like maybe six. I just read this and I know I'm wrong, but I was gonna say 6,000.
6,000. Okay.
That's a lot.
You know, the funny thing is, I am horrible with numbers, and people always laugh at me because I'm really bad at numbers. I have
And
another one in the chat.
And I just read about it and I'm like, thank goodness you're not giving us a test.
Oh, I don't do tests. It's okay. And I grade on a curve too, so y'all good.
Another guess was 3,000.
3,000. Okay.
I mean, it's a significant number, but I don't know.
So we have 6,000, 3,000, and a big number that I can't remember because I transpose numbers. So the answer is actually there are 200 defined mental illnesses. Is anybody surprised by that number?
Yeah, it seems low.
It seems low. Miss, I can only see a couple of you, but I see Miss Mickens shaking her head. What makes you surprised?
Because I feel like there should be like more cures out there in the world to help people. Like she said, that is just a very low number, in my opinion.
Well, to me, it seems like it might be low because mental illness has been such a hush hush. So maybe there are only 200 because we've kept it quiet for so long. So we haven't put the name on everything. Does that make sense what I'm trying to say? Whereas with all of these other diseases, there's always something that's stemming from something that's stemming from something, where with mental illness, there's probably so much more than we even realize because we just haven't taken, well, not that we haven't taken the time, but just because we haven't addressed it.
I think it's twofold, actually. I think that with mental illness, it is very hush hush, but I also think that when you look at mental illness and we're looking at how we define it, I think that we do have to keep it so broad, because even though the symptoms are very significant and defined, I tell my patients all the time, they manifest themselves so differently in people and how they look. Two people with depression look vastly different. And so it's very hard. And that's another thing and another reason why people who may be suffering from depression or anxiety, or even something as with schizophrenia or another illness, they struggle because the perception and how their presentation looks may be so much different that A, it keeps them longer to get help, to seek help, and B, it keeps them from feeling like people will understand. So the broadness of it allows for more people to seek treatment. But even in the new, we just got a DSM, which is what we keep all of our diagnoses in. We got a new one, and there was a new diagnosis in there now, which was called, as a grief diagnosis that looks at prolonged grief disorder. Because for a long time, people with grief, it was very difficult for them to get treatment paid for under the insurance. So this new diagnosis allows for people to get treatment with prolonged grief under insurance. So mental illness is an ever growing field, and I do think that we may find more diagnoses coming out, but they have also taken some diagnoses that they had and sort of realize that this is more of an anxiety diagnosis and put things with anxiety, or this is more of a depression and put it with depression. Because as we are treating more, we're realizing that things are more a part of this family and treating it with this and treating the symptom management with this, instead of just labeling it something else so that we can be able to treat people more appropriately. Does that make sense?
And I was actually shocked to see that it is 200, because when you kind of think about, I guess, the known diagnoses or the things that you can just kind of spill out, like let's say anxiety or depression or schizophrenia, I'm like, how is there 200? You know, like I wouldn't even know where to begin on listing them all.
Yeah, they're like, the book is like this thick. I wish I had brought it upstairs with me. And it's so interesting about how many different forms of depression you can have, or anxiety that you can have, or even PTSD, or even when you're looking at for delusions, personality disorders. There's so many different things that you can have. But when you go to look at the root base of them, a lot of them have to do with trauma, or they have to do with medical things. And so when we look at mental health, sometimes it's a combination of things. And being able to take a step back and see what's going on is very important, and not just looking at one facet of it. It takes time to talk to your provider, and that's one of the things we'll talk about as well. Any other comments or questions about that before we move on? You know, we'll look at depression and anxiety, just about some definitions and some numbers for them. Again, yeah, I'm really bad at numbers, but my friend is just like, she's a statistician and she's all about numbers. So she's like, you have to put numbers in. And I'm like, okay, I'll throw some numbers in there. But we'll look at depression and anxiety, because those are two of the ones that a lot of people know about and a lot of people are sort of hit with. And it gives you a better idea to know sort of what you're working with. When we talk about depression, I can't see my numbers because of the way that okay, here we go. About 1 in 6 adults have depression at some point in their lives. You know, depression can be something that people deal with throughout their lives. Or you can have what's called situational depression, where something has hit you and it hits you so hard that your normal coping skills, you may need a little bit more help with, to help you get out of that inability to function. And what depression really is at its core is, it is an overwhelming sense of sadness that keeps you from functioning. And when we talk about functioning and with depression, it's, you don't work, your mind is slowed. You know, one of the things with, and I guess when we look at mental illness overall, the definition really looks at how the illness and the symptoms impact you psychologically, emotionally, and physically. Because a lot of times when we talk about mental illness, we don't talk about the fact that there is a physical component to these illnesses. Almost always. You will see with depression, you will see what we call psychomotor retardation, where people move very, very slowly. You will see where sometimes the people feel like, oh, I'm going so fast, but they are really moving slowly. And they will say, I feel like it takes me forever to walk from the table to the sink, and they feel winded because their body has just slowed down so much. So depression can impact you that physically. So you'll hear people talk about how they are just physically tired all the time. And you will see people that are depressed, they talk about wanting to sleep a lot. And that's a part of it. The depression will make you feel, it'll impact your thought processes. Sometimes your thoughts are very, very slowed. Sometimes they're very, very rapid as well, but they're all negative thoughts about how you can't do things or things will never get better. And then your emotional well-being, you're in this sadness. We'll look at the ways that we can combat these things in a little bit, but are there any sort of questions about that depression and what that looks like? Okay. With anxiety, almost 1/3 of adolescents, people ages 13 to 18, experience anxiety. Anxiety is something that it can make you feel jittery from the inside out. That is a part of that physical component of it. It becomes very difficult for you to feel like you know what to do next. Oftentimes, my clinical supervisor would say, depression keeps you in the past and anxiety keeps you in the future. Anxiety keeps you questioning the what if, what's next, what happens next, what do I do next, what'll come up next. And things that normally wouldn't bother you, ruminate in your brain, and it becomes difficult for you to move on. Anxiety is very, when untreated, it can keep you so far in the present that you have very hard time being right here in the moment. That's why mindfulness is very, very helpful when looking at people with anxiety disorders and helping with anxiety. When we got into the current situation with the pandemic, we saw a lot of people who had anxiety, their anxiety increased because with anxiety, one of the best things that you can do or help with is having a routine, because anxiety questions the what if. Well, if you have a routine and you know what's coming up, then you know the answer to what if, right? But with the pandemic, a lot of times the question was, well, what's next? And the answer was, I don't know. So when you have anxiety and the answer is, I don't know, that don't mix too well, because I need to know what's next. So and a lot of our coping skills were taken away. So being able to figure out how the best way to mesh those two and to help people with something that we're still working on and helping people to figure out. Any questions about that? Is anybody surprised by how prevalent these two are? I wish I could see everybody's faces. I just can't.
Latoya, I can't say that I'm surprised, but I'm curious as to the prevalence of this. Has it increased since the pandemic?
So this is one of the things that, because we're still in it, I don't know that we have the research to support it.
Okay.
But I do think that it has increased people's awareness of it, simply because all of our natural coping skills were taken away from us in the pandemic. By that, I mean people who were anxious, couldn't go to the gym, and people who were depressed couldn't go to the gym and work out, or who had the borderline symptoms of the depression. And being able to be social and have that support system, you couldn't have it in the same way that you normally had it. So it was very difficult for people to be able to say, here's what I normally do. And even now, because when you have anxiety, you worry about how things are going to impact you. So their ability to feel comfortable going in, and their ability to feel comfortable switching and not using the mask and going out and being in big crowds impacts their ability to engage in these different things. So I think what we will see as research comes out of this is that you will see that the numbers have gone up, but it's gone up because people are feeling it more because they didn't have the ability to do the things that they were doing to cope with it. Does that answer your question?
Yes, absolutely. Thank you so much. I'm interested in that data, you know, when that comes out. I definitely think this is a topic to be ongoing.
Mm-hmm. I am too. And I'm interested to see how we're going to collect that data as well.
Mhm.
Because a lot of, to be honest with you, a lot of the treatment treatment facilities shut down. So even when you did experience that, there was a lot of places that people would normally turn to that they couldn't go to. So
Right.
people were trying to navigate this on their own. And Dr. Google is not your friend.
That's right.
You have a splinter and Dr. Google will tell you, you got to cut your whole finger off. So, you know, being mindful of that is very important.
Mhm.
One of the things that is very, very important in how we look at mental health, and what I tell a lot of my patients is the diagnosis is important for insurance reasons, but for you, it's really important for you to know how to manage what your symptoms are. Because with mental health, it's the symptoms that are going to get you, not the diagnosis. And it's important for you to know your diagnosis for you. But what is really important is for you to understand your body. And what is more important is for us to talk to our patients and talk to our support systems about what it looks like when those symptoms are changing and what we're not, like when we're at baseline and when we're not at baseline effect. So the skills, the knowledge, the competency, and the ability to have core people around you that are going to tell you, boo-boo, you're not yourself. Honey, what's going on? And to have those conversations with you and you feel comfortable with them. Does that make sense? So that's the first thing that is the most important thing. And that's talking about how you build your support system. You know, my support system is, of course, like, you know, my husband and first and foremost, and I have a great aunt and uncle and my father, but I also have 3 girlfriends who, when things are rough, we'll tell each other. And it's not always the fun stuff that we tell each other, but you know, it's those conversations in life where you have to have, and you have to be able to talk about, you're not yourself. What's going on? Talk to me about what's happening. You know, I like this picture because support is more than just hand holding. We don't always need a hype person that's like, yeah, you got it, you got it, you got it. Especially when you have mental illness. Sometimes you need the person that says, nah, boo, you don't got it. You might need to go talk to your doctor. You might need to go talk to your therapist right now. That sweatshirt is right. You've been in it for a couple of days. So we need to talk about that. So being able to know who your support system is that's going to be there for you, who is going to hold your feet to the fire, and who is going to not just be your hype person to tell you that everything is great and wonderful when things are not great and wonderful, so that you can get the support that you need. Any comments about that or questions about that?
Any tips on that support system? When we think about some of these things that may have shut down, how are we looking out for that person that's going to say to us, "You're not right"? Because I think do we need to be open to that, to hear that, right? How would we find that person? Or any tips on that?
I think that that's a conversation that happens when you're well, first and foremost, one. But I also think that, I am a very private person. I'm an introvert to my core. And so for me, I tell people that you have to be willing to be vulnerable. And you have to have very good boundaries when you're looking for these people so that you know who you can trust.
Very good points. Yes.
And you have to have discernment and know the difference between people who are going to be there for you and versus people who just trying to get information and tell all your business. Because those are
right.
people. And so being able to build those support systems is by looking at what are my boundaries and trusting people with a little bit of information before you give them a whole lot of information to see what they're going to do with it. And then just knowing in your core who you, and being at a place where you trust yourself when you're healthy. And so when you begin to become unhealthy and you see that, it's easier for you to trust them because you could trust them when you were healthy.
Right. Well, thank you for those tips. Definitely.
So, Latoya, we have a question in the chat.
Yes, ma'am.
What resources are available for people that are dealing with depression and anxiety?
Currently, I tell people, depending on what level of that you're suffering with, you can always call us at Mary Washington and we can walk you through that. And I have my number there. But there is a great resource and it's called psychologytoday.com. That website goes through and it lists literally psychiatrists and therapists and nurse practitioners, if you need medication management, which we'll talk about too, that are available in your area. And it talks about if they are taking new clients, if they're not taking new clients, if they're telehealth, if they're in person. And what it does is it kind of, and it also, you can say if you want a male, if you want a female, if you want somebody by age, like all different kinds of things that you can sort of break it down by. So it kind of takes the guesswork out of who's taking clients and who's not taking clients. And you can go in and look for that person to get you a resource for therapy as well. And for medication management.
I put the website in the chat for everybody if you'd like to use that as a resource.
Thank you, Ms. Mary. Is there anything else in the chat I need to answer?
Just another person commented that coping skills can really help.
And we're going to talk about that too in 1 second. Medication management, when we talk about medication management, I tell people all the time, and I tell this to people that when I worked with kids as young as 4 and 5, all the way up to my elderly people, when you are working with your provider, this may sound bad, but this is just how I feel. You pay your copay up front before you go back. So you let them know. I go in with a notebook. I keep little notebooks like this, right? So go in with your little notebook and your questions. If you have questions about your medication, you have paid your copay, so you get your whole 15 minutes worth of time. And you say, here are my questions. Here's what the medication did to me. Here's what the medication didn't do to me. It is okay for you to advocate for yourself if you are on medications. If the medication does not feel right, if you feel lightheaded on it, if you feel whatever on it, then you need to advocate for yourself. And it is okay for you to question the provider about the medications that you're taking. A lot of times people feel like, or at least when they're talking to us in the partial program and in IOP, they're like, well, I don't want to question the doctor. I don't want this. I don't want that. That is why it's perfectly appropriate for you to go in with your binder and to remind yourself ahead of time, I have paid for this time, so I'm going to use it to my full event. Does that make sense? And also, you are using this medication to help you manage your symptoms so that you can have a better quality of life. Any questions about that? We talked about psychology today. As a therapist, I am a jeans kind of a person. I believe that a good therapist should be like a good pair of jeans. They should lift your booty. They should be put, you can wear them, but you can have a good steak dinner in them too. You got a little bit of room, right? A good therapist is going to give you structure. They are going to help you grow. They're going to help you expand, but they're not going to make you feel so uncomfortable that you feel like you can't talk to them about things. You don't want a therapist that's just going to sit there and just be like your hype person that's just like, yeah, girl, you got that. That's wonderful. No, you want someone who is going to challenge you and help you to grow. But you also want somebody who is going to be your support system as well. And sometimes that does not feel good. Sometimes when you meet with your therapist, you might not like them. That's okay. We tell people a lot of times when they come into our PHP program, they don't really like us on day 10 and day 6 and day 7, because those are the days in the middle where we're really like challenging and having to help them. But day 10 and 11, they're like, we get it, we understand. Because that's what a good therapist will do. They will challenge and help you to feel that structure. And it's a good relationship. And you should be able to talk to them. Does that make sense? I am a therapist who believes in meeting people where they are. I am a therapist who believes that in order for us to get from North Carolina to Texas, we have to first know that we're in North Carolina, which means that we need to understand sort of what we are feeling, what is going on. Oftentimes when people ask us how we are feeling, what do we say? What do we say when people ask us how we're feeling? Anybody?
I'm doing okay.
Fine.
I'm fine. Yeah, I'm fine.
Doing okay. I'm
I'm
hanging in
good.
there. I'm good.
I'm okay. Everything's good.
It's all good. Today's a good day.
Mhm. When we look at this feelings wheel, we see that there are like so many feelings. And a lot of times people are like, that's a lot of feelings. Like, And a lot of times we can have a situation where we have very mixed emotions. Very mixed emotions. You can get a new job. What do you feel when you get a new job? Anybody?
Excited.
Excited?
Nervous.
nervous. Let me write these down.
Anxious.
Anxious.
Mhm.
What else?
Maybe insecure because you're going into a new environment.
Mhm.
Optimistic because you are going into a new environment.
Have excited, nervous, anxious, insecure, optimistic.
Overwhelmed. I think there are so many contradictory feelings, you know, because you could be overwhelmed, but you could also be energetic because it's new and you're, you know.
And you could possibly probably feel distant because you don't know everybody in the environment. So like you're trying to talk to people. So distant could be one as well.
Mhm. Anybody feel sad?
Oh yeah, you could feel sad because you're leaving your old job, or if you are leaving whatever you had before that new job, whether it was an old job or school or whatever, you know, leaving what you knew. Or if you had to move, you could feel sad because you had to move.
But when
Sad
people,
because you had to commute.
look, community in Northern Virginia ain't no joke.
Yeah, exactly.
But when people ask us how we're feeling about the new job, how many feelings do we give them?
One.
One, yeah. Mm-hmm.
When we take a moment and we think about it and we look at it, there are so many opposing feelings that are going on inside of us. And this is just one situation that most of the time it's a very happy situation. But we don't take the time to say, I have a lot of different feelings about this. I am glad, but I am also sad too. I'm sorry, go ahead.
No, I was just going to say, sometimes I feel like in certain situations, it's almost as, for me, if I tell people how I really feel, then people hold on to that one feeling. Well, she felt really scared. If I say, oh, I'm really excited or I'm really nervous, Kimberly is so nervous about such and such. You know what I mean? So I find that I just stick with, I'm good. I'm okay. I'm fine. I'll be okay. Instead of sharing the mixture, because the mixture of, or the negativity, like what I've found is like people will hone in on that negative stuff. I'm like, wait a minute, I didn't say that. I said this, and this, not just that. So that's just my percept or what I've experienced.
So it's a twofold thing. One, and we don't do, it's my observation that because we have not been taught how to process multi-dimensional emotions, complex emotions, people a lot of times don't know what to do with it when we're telling them multiple emotions. And also because we are oftentimes rushed. Like a lot of times when people ask you how they're doing, they're already walking down the hallway before you answer. Like they don't even stop, right? So being able to have these conversations when you're going to give people complex emotions, when you're going to give people, this is how I really feel, you have got to set the stage. You've got to be sitting down. You've got to be ready to have this conversation of, this is a complex feeling for me. This is really what I am feeling. And have that situation, have that conversation with them where they understand that, yes, this is a complex situation. This isn't just one thing that I'm feeling. The second part of that is you being okay and understanding and accepting of the fact that you can put that out there, but you are not responsible for other people's reaction to your emotions. You are responsible for your explanation of your feelings, but you're not responsible for people's reaction of them. You know, when we're learning how to healthily communicate, we can communicate back and forth. And we can use I statements, and we can be very mindful of how we say things, because oftentimes it's not about what we say, but how we say it. But if you're communicating complex feelings and someone chooses only to see the negative things about what you're saying when you're saying negative and positive, then you can't control that. Does that make sense? You know, when we think about the significance of the complexity of feelings, and we think about the significance of how many things that we go through a day, there's no wonder that when we get home, we are tired. Our emotions make us tired. We just don't talk about that. We don't talk about Bruno. That's one of my favorite songs. We don't talk about Bruno. Engage in coping skills. Coping skills can be anything that is healthy. I have an older child. That boy can read a book in a day, and he just loves to read. It can be watching football. I like to walk. I like to put my headphones on and walk. Don't talk to me when I walk. And some people like to walk and talk. I don't want to walk and talk. I want to listen to some music and walk. I don't want to talk to you then. Some people like to, I have a cousin, she's like 20 something years old. But if she sees a swing, it's like her happy place. She will get on that swing and she can swing for like 30 minutes and just be like a 5-year-old kid, like just as happy as she wants to be. You can find whatever your coping skill is and engage in it. Some people love to cook. You know, there's a running joke with one of my cousins. If she is really upset, she will make the best meatloaf you will ever taste in your whole entire life. Because she just takes all that chopping and that like grind and the meatloaf and stuff. But your coping skills are things that you can really enjoy. It can be coloring. It can be whatever it is. It doesn't have to be something fancy. You can go to the Dollar Tree, which is my favorite store. They make fun of me at work. Dollar Tree is my friend. It's $1.25 now, but it's still my friend. They have these little scented things that you can get in the bath section. And you can put them in your shower, at the bottom of your shower. When you take a shower, you don't even have to take a bath. They're called bath salts, but I just put them in the shower. Put them in the shower and sit in your shower for a little bit of time. They have rose scented, they have lavender, they have vanilla. You can just go in there for $1 and make your own little spa. Shower it up, makes no own sense. So sometimes you just need to find out what makes you calm and do that. Dollar Tree is your friend, people. Dollar Tree is your friend. Lastly, we'll talk about some out of time. I'm sorry. Mindfulness is really something that's really cool. When you were little, you used to play I Spy. And so one of the things that I really, really like about this is that you can put up in your office, you can put up wherever you work, you can put up wherever you're in school. Put up something like when you're really, really stressed, that is one of these colors. It's a primary color or a color that you can look at and count to 10 and relax with. So whenever you feel overwhelmed, you can look at it and just feel a little bit more calm. I have 3 pictures that are right in front of my desk that I painted. And so if I'm really overwhelmed or I just need a moment, I can look at a deeper color in there and count to 10 and sort of relax. This is my direct contact information. If anybody wants to write it down, contact me, call me, ask me any questions. Please, please do not hesitate. Are there any questions for me right now?
I want to thank you for your time.
There's other thank you shout outs, Latoya, in the chat.
Yeah.
I want to thank you guys. I really enjoy doing these
Yeah.
because I love mental health and I think it's just a great way to get people talking.
And I think there was a person named Darlene Thompson who gave me this information. So I appreciate her giving me this because I'm a student at Liberty and I'm looking for a place for my internship. So I'm actually going to send some information over to her, and that's why I jumped on here, but I appreciate it. I really do.
I went to Liberty too.
Yeah, so you're
Oh.
going to be, hopefully, I don't know if you're the person who looks at the information that comes through for practicum and intern students, but I'm going to be sending my information over. So, yeah.
All right.
Alrighty. Well, thank
Yeah.
you so much, everyone, for joining. I am going to put the evaluation survey in the chat. We are
It
asking
was
that
wonderful.
please fill this out today. Latoya, that was a great presentation.
Mhm.
Just so everyone is aware, we are going to break for lunch 12 to 12:30. Our next session will be at 12:30, community health. We have a representative from the Mary Washington Healthcare Home Health and Hospice Department who will be speaking.
Latoya, thank you very much. I appreciate
Yes.
it. And Kim, I'm
I didn't
actually on the
see you
call. I'm
there.
Darlene. Hi.
I'm
Thank
sorry.
you all so much. We appreciate it.
Thank you. I'm sorry, say what, who, are you Darlene?
I am Darlene. Yep.
Hi, Darlene.
Kim, how are you?
You're so wonderful. I've got an email working for you today. So,
Thank you. Thank you.
Yep.
I appreciate it so much then.
no, I appreciate you because you're so kind. I mean, it's just so helpful.
Thank you.
So, thank
Yeah,
you.
thank you. And Latoya, thank you for all of the information. I'm so glad. And participants, as I said, more to come. And then Latoya, I'll be reaching out to you, and Kim, of course, you have my contact information as well then. So everybody enjoy lunch,
Yes.
and we will all talk soon. Come back
All right.
after lunch. We'll be back.
All right. Thank you so much, everybody.